I think probably a few of you have heard of UPS as the global transportation logistics company. But what I'm going to talk to you a little bit about today is UPS, the healthcare logistics company, and what we do, and then I'm going to share with you some of the insights that we have as to what some of the challenges, what some of the issues, and what some of the trends are in healthcare logistics, and how we can collectively kind of address some of those issues. So UPS has a fairly substantial healthcare logistics practice. We have a significant amount of facilities around the globe that are dedicated to healthcare logistics, storage, distribution. And these are healthcare dedicated facilities. They are validated for healthcare. They are compliant. It's typically about 4 million or so total square feet of distribution space. And really the focus of what we do is really make sure that we have very highly compliant processes and procedures for life sciences companies that want to outsource their logistics to UPS. So our whole model is really a end-to-end integrated logistics solution for many pharmaceutical, medical device, biotech companies as well. And the idea is that we have the compliance, we have a regulatory group of tens of hundreds of people who are really following all the specific regulations that apply specifically to healthcare logistics and distribution. And these teams of individuals who work with our clients to put together very specific solutions that include distribution, transportation, across many modes of transportation, as well as doing what we call office services or the complete order-to-cash cycle. So there's several virtual type of healthcare companies that do a lot of R&D, they outsource maybe perhaps their manufacturing, and they do sales and marketing, and they don't necessarily want to handle all the logistics. So we provide a complete outsourced solution where we receive orders for their finished goods, we warehouse the finished goods, pick, pack, ship, and do the transportation, the end-to-end, and all the visibility associated with that. And it's a service that we've built up over the past 10 to 15 years, and through a number of acquisitions, as well as just growing the thing organically within our organization as well. Highly focused on compliance, highly focused on quality, because it's clearly the mode of what's required to serve the healthcare industry. In fact, we have a slogan that we use within our part of the organization, which is it's a patient, not a package. And the idea with that is simply that we're not necessarily moving boxes. We're serving patients, we're moving something for a patient that's not ultimately going to affect or save somebody's life potentially. And you have to have very, very tight processes and procedures and highly compliant processes to accomplish that goal. So looking at some of the trends and some of the things that are going on in the healthcare supply chain that really, actually it's really trends within the healthcare industry that have a interesting effect on the supply chain for healthcare. And it's things that we are very focused on and make sure that we are on top of, because we know that that's where the healthcare supply chain is heading. And the first trend we look at is the consumer or the patient. And patients are getting a lot more involved in their healthcare, and they're getting a lot more involved in the decisions. And the implications that has in the supply chain is these patients now are looking at alternative products, alternative remedies, and they're not necessarily just trusting what their physician is recommending to them, and they're looking for new things. So the impact on that is there are patients now that are beginning to drive how products get to them, where products come from, and what services and products that they require. And it does have an impact on the supply chain. The other big one is globalization. If you look at the current patient populations around the world and where healthcare is consumed, and you look at where it's going to be consumed in the next 10 to 15 years, there's some dramatic shifts that are going to be taking place. In particular, there's going to be a lot more healthcare consumed in Asia and a bit more in Latin America as well as Eastern Europe. And a few things that are driving those shifts I'll talk about in the next slide here. But there's obviously the population growth in those parts of the country and those parts of the world. But in addition to the population growth, there's a lot of government initiatives around healthcare and expanding healthcare. So it's not going to be as North America-centric as it has been. And the challenges that is for the supply chain is those countries are a lot more difficult to operate in and a lot less established from a transportation or logistics infrastructure. than North America. And furthermore, the regulatory environment is fairly new, and there's a lot of indecisions and a lot of difficulty in terms of getting past all the regulations to operate properly for your healthcare products in those countries. Regulatory oversight, kind of touched on that. There's increased regulation throughout the industry, and even as it pertains to the healthcare supply chain. Regulations around security, around temperature controlling products, and it drives a significant amount of cost into the supply chain. And those are things that we all need to manage. We need to understand what those costs are and try to keep those costs down as low as possible. At the same time, we need to comply with the regulations. It's really not necessarily an optional process in the healthcare supply chain. The next trend we talk about is power of the payer, and so payers are getting a lot more involved in healthcare and driving a lot more of the decisions all the way from the manufacturer, all the way back to the consumer. And the thrust there is driving down cost and getting the most efficient healthcare solutions as possible in terms of the best outcomes for the patient at the lowest possible cost. And that has a profound impact on the supply chain, and we need to find ways to continue to make the supply chains more efficient and more effective at the same time meeting all the needs that are required by the patient. And then finally, the last trend is we see significant is risk mitigation. So a number of things. So there was the avian flu scare, there was Hurricane Katrina here in the U.S., and it heightened the awareness that we all need to be a lot more vigilant in planning our supply chains around business continuity planning type of procedures, making sure that we plan for those possible disruptions in the supply chain, that we plan for those types of possible outbreaks of epidemics that require specific products to be accessible in different parts of the supply chain in very short notice. So talk a little bit about the global supply chain and how there's a shift in where healthcare is going to be consumed. And this chart here really just kind of draws it out, and it really just makes it very clear that North America is the dominant consuming market for healthcare today. But if you look out into the future, based on specific government plans, changes in birth rates, changes in population growth, as well as emerging economies who are going to have more economic means to consume healthcare and provide healthcare to their population. Clearly, the impact here is more reach into more parts of the world where supply chain is even more complex than it is in other parts, more established parts of the world. And then finally, for those of us who are based in Georgia, how is Georgia and how does Georgia fit in the whole supply chain and the healthcare logistics? We do a number of studies for our customers where we try to understand where is the best place for them to distribute their products. And in this case, this example here is North America. So this is a healthcare company based in Georgia looking at where their products are distributed and trying to understand how many days, or where should they locate, where's the best place to locate their distribution facility, in this particular one, to get as much coverage as possible in 2 days using ground transportation, in this case with UPS. And incidentally, when you look at the North American population, patient population, the Atlanta area is the best location in the country to hit the highest amount of the patient population with a 2-day ground time in transit. About 65% of the population can be hit within 2 days on the ground for products. Now, if products require a shorter time in transit, or 2 days is the thing, then anything beyond that, the other 35% can be moved via air. And obviously, so that hits the California area. The interesting thing about Georgia is you can get all the way up to New York City in 2 days, and all the way down through Florida, where there's a significant amount of patient population, and most of Texas, where there's a significant amount of population. The West Coast would need to be fed by air in this case. And these studies we do for clients really look at the different needs of the specific products that they're distributing. Some products require 1 day time in transit. 1 day required, there would be a different location that would be most optimal for a 1-day transit. And then I guess the other interesting thing about Georgia is if you look at the port of Savannah and where it is just geographically located, it is along the East Coast. It has the most reach of any East Coast port going west into the U.S. So bringing things into the port of Savannah and being able to distribute from the Georgia area to most of the rest of the U.S., you have a days in transit operational advantage from ground transportation from the port. Obviously, Atlanta is the biggest, most busiest airport in the world, so there's a lot of connections for air flights, and then obviously with UPS in Louisville, Kentucky, we have our global reach for air transportation anywhere in the world as well. So Georgia is a great place for distributing and managing healthcare logistics, and there's a lot of things that we all do in trying to understand where the market's going and make sure that we build proper supply chains and logistics to accomplish all those shifting goals and shifting priorities in the healthcare supply chain. So with that, I will turn it over